Hi, my name is Mark Deshur. I'm the founder of ORlogic. I'm an anesthesiologist. I work at a mixed academic community health system in the suburbs of Chicago. We are responsible for providing coverage of 75 or more locations every day, but some days that could be 65 locations, some days that could be 85 locations. The demand is extremely variable. And one of the challenges that we have is that the schedules are made months in advance. There has to be a better way. It can't be that the day before we're scrambling to find the right number of people. If we could only predict what the demand is going to be, if we could only predict how many operating rooms or anesthetizing locations we were going to need to cover on a given day, we need a way to skate to where the puck is going to be, not to where it is right now. So it integrates with the systems you already use. It integrates with electronic medical records like Epic and Cerner to pull in historical cases as well as future case schedules so that it can predict what the workload is going to be. And it integrates with the staff scheduling systems that you already use like EasyCall or Qgendo or Amion to help see who's already scheduled and what changes do you need to make to that schedule so that you have just the right number of people available. There's an anesthesia group that we work with that had been staffing for 30 rooms every day. They were told by the hospital that they had to provide 30 rooms of coverage every day, and so that's what they scheduled to. There were days where they were overstaffed and there were days that they were understaffed. In fact, about 40% of the days they were either overstaffed or understaffed relative to the actual volume versus the 30 rooms that they were told they needed to cover. And by adjusting their staffing, they are saving about 7% in their overall labor costs. Instead of calling people or emailing people the day before and asking them, can you work extra tomorrow? I know it's your day off, but we're really short-staffed and we need help. Or calling somebody the day before and saying, we don't need you, we're gonna need you to take the day off tomorrow. And by the way, you're not gonna get paid. We don't do that anymore. We're able to have those conversations days or weeks in advance. So ORlogic has been a huge improvement to our staff morale and burnout. The staff in the operating rooms are some of the most expensive resources in a health system. The relative cost of ORlogic is minimal compared to the potential savings that our organizations are seeing by improving their staffing efficiency, by lowering turnover amongst their providers, by bringing in additional revenue, by filling your ORs and opening up additional operating rooms when you have available staff. So there are a lot of systems out there today that provide dashboards, but there aren't any systems that provide a staffing dashboard that shows you exactly the number of ORs and procedural areas you're going to need to run, as well as how your staffing compares to that predicted demand. Many of our anesthesia groups have coverage requirements where they're responsible for covering a fixed number of rooms, irrespective of the volume of cases that might be scheduled. ORlogic is still helpful in practices like that because let's say next Friday you're required to provide coverage for 30 rooms, but ORlogic predicts that you're only going to need to run 25 rooms. You can go to other parts of the organization. Maybe MRI has a backlog and is looking for more anesthesia time. This gives you that lead time to be able to look around and draw forward some demand that may exist in other parts of the organization. As changes are happening to your schedule, ORlogic is updating those forecasts in real time to show you the change in the number of rooms, if somebody goes on leave of absence, if you hire a new person, all of that is brought into the dashboard in real time. So ORlogic helps you predict the future demand in your operating rooms and align your staffing to precisely that demand.